You're welcome to Consulting Room 5 with me, your host, Dr. Sue. We bring you insights and real stories that matter most to well-being. Today, we are focusing on a topic that touches millions of lives across the world, breast cancer, and the life-saving power of early detection through breast screening. Breast cancer is the most common cancer among women globally. But the good news is, when caught early, it's one of the most treatable. That's where regular screening comes in. It can make all the difference. Joining us in the studio today, we have two incredible women. First, an oncology nurse and breast health expert, here to explain what breast screening is, who needs it, and when to start. And beside her is someone whose story will inspire you, a breast cancer survivor who credits early screening with saving her life. She's here to share her journey of courage, hope, and resilience. You wouldn't want to miss this. It's very interesting and very insightful episode. We will be right back after the short break. Stay tuned. You're welcome to Consulting Room 5 with me, your host, Dr. Sue. Today we have a very beautiful lady with us. She is Miss Juliet Mills-Luttrot, a mother, wife, philanthropist, and director of the House of Jewels, comprising of Jewels Collection, GJ by Jewels, Jewels Hair Collection, Jewels Magnetic Lashes, and Ujana by Jewels, all of which adds up to, or the profit is given to Pink for Africa, which is an NGO. She's the CEO of that NGO, and she strives for success and also impacts the world with her greatest desire, as evident by her products and services. After surviving for breast cancer, this industrious personality has redefined innovation and ambition to keep raising the bar as a self-made, successful businesswoman. She's an entrepreneur whose inauguration of her brand name has changed how the world reckons the act of survival. Miss Juliet has survived breast cancer for 17 years, and she's going to share her journey, how she went through this whole journey with all resilience, hope, and how she was able to work hard to also get through to this. Pink for Africa is a foundation that was set up by her and raised breast cancer awareness, and it was born in 2010 after a journalist has asked Juliet, if you never lived in Africa, or America, sorry, would you be alive today? If you never lived in America, would you be alive today? After pondering over that question for a while, Juliet realized that the one difference she had gotten was to live in America. So let's hear her out, even as she comes today on Consulting Room 5, how she went through her journey and how she's been able to live through it within this whole 17 years. Miss Juliet, you're welcome.
Thank you so much. It's a pleasure to be here.
I love your dress.
Thank you.
It's so nice.
Thank you.
Really pink, 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 pink.
Yes, it's the pink month.
Yeah, sure. Let's meet Enam Ajo-Sechofia, who is an oncology nurse specialist and works at the National Radiotherapy Oncology and Nuclear Medicine Center at the Korle Bu Teaching Hospital. She's also the chairperson for Screening and Outreach Committee at the Breast Society of Ghana. Hello, Miss Enam and Miss Juliet. You're most welcome.
Thank you.
We are privileged to have you ladies in the consulting room. And I like the way we are all in pink, even though we didn't decide to.
It's a pink month.
It's a pink month, yeah. Okay. So Miss Enam, I'll start with you. It's a pink month, so what is it about breast cancer, breast examination, anything breast?
Yes, so all over the world, the month of October has been designated for creating awareness for breast cancer. This is just because breast cancer is the leading cause of cancer death among women, not only in Ghana. And so for us, we wearing pink is just a symbol to show that breast cancer exists and it's important for everyone every female and even males to examine their breast.
I hear there is a percentage of males who can also have breast cancer.
Yes. So if you talk about the risk of breast cancer, we take 1 in 100 males. So one person out of the 100 population together would get breast cancer, and it is 1 in 8 women. So it tells you of how
prevalent it is amongst women.
Exactly.
Okay. So, Miss Juliet.
Yes, my dear.
You're welcome again.
Thank you.
I love your resilience. I love the brightness in you. I mean, anytime I meet you. And what is it that inspires you to move?
You know, I think that is also a personality thing. It's never what happens to you, it's how you get through it. I think that your attitude on life is important, and different things will happen, not just necessarily breast cancer, but other things can happen to you, and you have to push through life. That's just it.
That's true.
You know?
So early detection saves life.
Exactly.
How do we detect it?
Yes, so we encourage that you do a self-breast examination, or what others call breast self-examination. That's about examining the breast by yourself. And also, annually, if you are between, you are age 40 and above, annually we encourage you to visit a clinic where a health professional can examine your breast for you. So that's what we call a clinical breast examination. And that alone is not enough. We encourage that if you are age 40 and above, you do a yearly mammogram. So the mammogram is a machine or a device that helps to screen the breast, and is able to detect a lump at its earliest stage. And it's very, very small. It's able to detect it. So it's not enough to do a breast self-examination at home and then sit at home and say, well, we've covered it all.
Especially at 40 and above
Exactly.
ages. Okay.
And then even if you are below 40,
Okay.
we encourage you to visit the health center or hospital where a health professional can examine your breast once in every 3 years.
Anybody, at any woman?
Yes.
At what
if you
age?
Are
at
below
what
age 40, you can
okay.
do that between 1 to 3 years.
1 to 3 years.
But at all costs, if you are about 40 years, you should try and do that yearly.
At what age should we start the self-breast examination?
Yes, so these days we see breast cancer as early as 19,
Wow.
20. I mean, the books we read tell us where breast cancer starts, age 40, older women and above. But these days we see it in very young people. And so it's advisable to start screening as soon as you see that you've started developing breast. So puberty in early adulthood, late adulthood, all the time. We encourage that you know your breast. At least when, if you are in puberty, we encourage that to know your breast, know how it looks like. As it said, charity begins at home. If you start doing it that early, you will grow up and it sticks with you, and it sticks forever. Yes.
So, Miss Juliet, at which age did you detect the cancer?
So, in the United States where I live, when you turn 40, it's part of your routine check with your physical. So at 40, I went in for my mammogram and I got called back to do an ultrasound. And that then followed up with an MRI, and it was detected with the MRI.
So the mammogram did not detect anything.
No.
Why did you go in for the MRI?
I was called by my doctor to come in because my breast tissue was dense and they couldn't see through the tissue.
Okay, so they wanted
I think
to
that
do
there's a
further
possibility
investigation.
they had seen something, they just wasn't sure, and they needed more
Suspected.
clarification.
Okay.
So the MRI picked it up right away, but the MRI also had to do a guided biopsy. So the MRI was what did my biopsy. So that was when the biopsy results came back and it tested positive.
So, did you feel any pain before the examination?
No, early stages of breast cancer has no pain at all. I think that that is part of why we promote so much of self-examination and making sure that if you
Were you doing the self-examination?
To be honest with you, no. I had done plenty of walks and worn all the clothes and done all the things that was necessary, but I wasn't doing self-examination at all. So I think that hearing myself say this is part of why I do what I do. I advocate so much, not only because I got lucky, because my tumors were found very early, but I think it's important for us not only to talk about it, but to also hold each other accountable for making sure that we follow through, we do check our breast 1 week after our periods and learn how to do it. Pink for Africa starts from age 12. So we
just as she said,
exactly, which is excellent. So I think that it's really teaching the young girl a way to get to know your body and not be, to be proactive with your own body and learn about yourself. Yeah.
Mm-hmm. When the news was brought to you, how did you take it?
It is the C word. So I don't care who you are. When that news is given to you, your whole life will flash in front of you. I was a mother of 3. My youngest was 9 years old at the time. And it was tough. I don't remember the drive home. Let me just say that.
Did you go alone or you went with your partner?
I went alone. My husband was away on a business trip. So I went alone. And I wasn't feeling 100% when I went to see the doctor. I think I had the flu. So it was rough. I remember coming home, taking a nap, and waiting for the day to be over for me to just let my husband know and then begin.
Oh, you were able to take a nap?
Oh, yeah. Because, again, the things you can control, you can control. What you cannot control, you cannot control. As much as I was panicked, I'm a very controlled person. So I knew, okay, let me put it in the back and I'll come back to it. And I needed to rest because I had the flu that day. So I needed to rest and gather myself. And then I told my husband, and I felt bad that I was telling him while he was away on a business trip. But I needed to offload it. I didn't want to offload it to my children. Yeah. So I offloaded it to him. And immediately that evening, I started reading about what are my options and where do I go from here.
Did you have any counseling before?
So I come from a very big family.
Okay.
So fortunately for me, the kind of support system I had was very, very good. So I didn't need outside counseling besides my family. And I'm a very self-motivated person. So anytime I'm down, I'm going to push myself up much higher than I was prior. It's just how I'm wired.
Self-motivated Miss Juliet.
Yep.
Okay. That's a very good spirit, yeah? Okay, so Miss Enam.
Yes.
I've seen that you have a very nice boobs on your chest.
Exactly.
So how do we examine our breast at home?
Okay. So breast examination has to be done. If you're a woman who is menstruating, then you wait 7 days after your menses because when you are menstruating, your breast is full, tender, and so at that time, it's not a good time to examine your breast. And when you are ovulating too, the breast feels fuller, and so if there's anything in there, you may miss it. So you target the days in between menstruation and ovulation when you are done menstruating before you ovulate. So usually 7 days after your
about the 10th day or to about the 12th day.
Yes, so you can examine your breast. And then if you are menopausal, it means I am not menstruating. And so you can choose a day in a month to do this examination. And if you are breastfeeding, you're a lactating mother, then you would also choose a day in a month. But that day, make sure that you have actually breastfed your baby so well so that the breast feels a bit lighter.
Not be too full.
So then you can do the examination. Okay. Yes, so, right, you have to, if you have to do this at home,
right,
then you have to stand in front of a mirror. Okay. The first step is inspection. So you want to inspect your breast. You put your hands by your side and then you turn. So you inspect your breast You are looking at skin changes. You are looking at dimpling. You are looking at change in direction of the nipples. You can also be looking at if there is anything different from how your breast looks like. Obviously, for every woman's breast, one looks a bit bigger than the other. It's normal. So we encourage that you know your breast, so that if you find anything abnormal, you can report. So now I want to examine my left breast. So I put my right hand under my head like this.
Okay.
And I draw an imaginary line in the breast. So in two halves, first half and second half. Then I start in the middle. So we'll go clockwise, just like the clock moves.
Okay.
Okay. So I start this way using firm, deep pressure. So importantly, you need to ensure that these three middle fingers are put close together, okay, because this is what is going to do the magic. Okay, so then you start at the 12 o'clock position and you work it out all round the breast. Okay, take your time because you are doing this at home. There is no pressure on you, so you do it gently and move. Use firm pressure. Okay. Go clockwise, clockwise, and then come back to the 12 o'clock position. You continue working it inwards, making sure that you have covered the other parts that you first examined. So just a little overlapping, and then you keep going, keep going, keep going until you have covered the whole breast. So you work it out in and outwardly, making sure that you cover.
Do you have to put soap or oil or something for it to be smoother?
Well, if you are home, you feel like doing that, there's nothing that prevents it. It makes your hand feel more smoother if you have to. But there's an important point that a lot of people miss in the examination process. Because we preach go clockwise, a lot of people go clockwise and they forget that when you get to the nipple, what you need is a firm pressure on the nipple so you can feel anything underlining the nipple. Okay, and it's important that you squeeze your nipple a bit to see if there is any discharge. If you find anything, very little creamy discharge, it's okay, it's normal. But if you find anything offensive, you find anything bloody coming from your nipple, you need to report it. Okay, that's not the only part of the breast. You realize that some people have what we call a second breast. Okay. You know, local people will say, "Owonufubium, ewanamotium," kind of. Okay, so what we call the axillary tail of the breast, you need to examine and go all to that part. And then your axilla, you need to examine your axilla, your armpits. Go in, down, upwards, sideways, everywhere. Go in. Because for some people, the lump may not start in the breast. It will start in the axilla, the armpits. Yes, exactly. So after you are done with this process, you repeat for the other part of the breast, creating that imaginary line, starting at the 12 o'clock position and working it out all round, just like we demonstrated for the left breast. Okay, you work it out, go in, making sure that you have covered every part. And so this is the clockwise position. Somebody may say, well, is this the only way you can examine your breast? No, that's not the only way. You can also choose the up and down fashion. The up and down fashion, what we call the symmetrical.
So like you fashion. Go up, you go
up
down.
And down.
Why fashion?
Well, I mean pattern.
Pattern.
Yes. Okay. So you can start it inward, move it up, coming down in the same process. So don't forget to use the first three middle fingers to do this process. And so you move it up and down, So you have covered the whole breast, the entire breast. Okay. So we move it, move it.
Can your spouse also do this examination for you?
Well, what we encourage is that if you want your spouse to examine your breast, yes, I mean, that's your spouse. He has every right to do it. Well,
is it a right or is for help? It's not a right.
Well, you can call it as you wish, but I think that your spouse can also help you get into better shape or better health. For some people, they will tell you that, well, it's my husband who said he felt something.
People I heard
yes.
who had cancer who had those lumps said their husbands or
yes.
their partners felt those kind of things.
Yes.
So is it advisable?
Yes, of course. If the men are helping us find it early, why not? Yes, it's advisable that you encourage that your spouse can as well check.
Miss Juliet, yes. Did your husband mention anything of that sort to you? That
No. Mine was not detected with the human hand. Mine was not. But I encourage women because in the journey with Pink for Africa, I've come across a lot of women whose husbands felt
yes, I've heard
lumps.
so many of them. Exactly.
I think, we can do for each other. The men also, like you mentioned in the beginning.
1%.
Exactly. So I think it's important that we both learn proper self-examination. And while you have fun, by all means.
Sure. So is it, because some people have also asked me that when the men have said that when they suck their partners or their wife's breast, they felt some discharges or something, like they felt that it was breast milk, but you realized later that it wasn't when you were talking about the nipple discharge. So how do you encourage people to do that?
Yes, so for every woman, there's a little discharge that may come out of your breast. That is normal. However, if you find that you have so much discharge coming from your breast and you are not breastfeeding, I mean, you are not lactating and breastfeeding anyone, then obviously you need to go for a check. It may not be normal. And like I said, if you find anything bloody, if you find anything like an offensive discharge coming from the nipple, you need to check that too.
Interesting. So you encourage sucking of breast?
Well, sucking of breast for a baby.
Is it a myth for
baby?
For the men? Because the men are just disturbing me, my crew and all. They are disturbing me that is it good for them to suck their partner's breast?
If it's for pleasure, fine. I cannot say no. That's for pleasure. But if you are talking about breast cancer prevention, it doesn't add anything to it.
It's a myth, is it?
It's a myth. Yes. What we
so
encourage
it's a myth, please.
Is that
it's a myth, please. Men.
What we encourage is that if you got pregnant and you delivered, at all costs try and then breastfeed your child.
Right.
Because at that time where you are breastfeeding, the hormone prolactin goes up. This prolactin is what helps to produce the milk. Yeah. And at that period of breastfeeding, you are protected from getting breast cancer.
So the more children you have, the more protected you are,
well,
or the more breastfeeding that you do?
Well, the more breastfeeding, the breastfeeding gives you a break.
Yeah.
It gives you a little break from menstruation.
Right.
So, well, that period where you are breastfeeding.
That is even when you are doing exclusive breastfeeding?
Yes, it should be exclusive.
Okay.
Exclusive breastfeeding. And you should have breastfed for about 1.5 years to get that protection.
Okay.
That being said, doesn't mean that when you are breastfeeding, we cannot find a breast lump or you cannot be diagnosed of breast cancer. Okay, we have found some people who at that stage breastfeeding and yet have some form of cancer in their breast. So it's not totally to say that if you are breastfeeding, then you are free and so you will not examine your breast. That's why I said it's important that you pick one day in the month where you have fully breastfed your child, and then
that the breast is empty.
Yes, then you examine your breast.
A menopausal woman, when is it appropriate?
So for the menopausal woman, you also choose one day in the month. Okay, so if I chose today, let's say today is 10th October, I chose 10th October today, then
or 14th,
yes, or 14th, or whichever date you choose. Then the next month, the same date, you can examine your breast. Yes.
So it should be routinely?
Yes, routinely done. Every month, you try and examine your breast.
Great. So we are in consulting room 5. We are discussing breast screening, breast cancer, everything about the breast. You can see Miss Enam's beautiful breast. She has shown us how to examine the breast clockwise, and then for both sides, and then the different ways, the signs that you can see that will prompt you to visit the clinic. Miss Juliet has also given us a little insight about how she managed her breast cancer when the news was brought to her. We'll take a quick commercial break, and after that we'll talk about the signs, the types of breast cancer, and we'll also look at a few things about how to go through the journey if you have it, and if you don't have it, what are some of the things that you have to do to prevent breast cancer. This show is brought to you by Unicom Chemist. Unicom Chemist is the only pharmacy that you should visit. It's all over Accra here. You visit to buy everything about medicine, everything about drugs. You're still watching Consulting Room 5 with me, your host, Dr. Sue. We'll take a quick commercial break, and afterwards we'll continue with it. Stay tuned. You're welcome back to Consulting Room 5 with me, your host, Dr. Sue. We are discussing Pinktober, breast cancer, the treatment, lifestyle modification, and all that. So before we left, we were talking about how to examine the breast. And so Miss Enam will quickly take us through it and give a short recap on how to examine your breast personally. So in a very short and brief way, give us a recap.
Yes, so when you stand in front of the mirror looking, inspecting the breast, it's also important to put your hand around your waist and then bow down a bit so that your breast can relax, and then you can see whatever happens here. It's also important to lift your hands up and then examine what is under the breast. At this stage is the inspection stage, so you want to see whatever is hiding in the breast. Okay, it's also important to go the clockwise fashion like we earlier demonstrated. Okay. And then using the symmetric face, whichever one you are comfortable with. And then there's another method that's called the wedges, where you work it all into the areola, the nipple, and okay, you pick it from all the angles, work it into pick it.
So do we only have to stand, or we can sit or lie?
So this can also be done lying.
Okay.
But at all costs, try and inspect your breast. So you do the inspection in front of the mirror. Okay. But you can repeat this process when you are lying. You can do it in the shower.
Morning, afternoon, or evening?
So anytime in the day, anytime in the day you choose is convenient for you, you can do it. You can do it in the shower. You can do it in your bedroom, your sitting room, wherever is convenient for you. Yes.
Miss Juliet, so you've had, we've been managing this for the past 17 years, yeah?
Yes.
Okay. So how long did the main treatment take?
So from beginning to end, it took me roughly about 2 years. But you know, it doesn't end. You know, for me, 10 years after my reconstructive surgery, I went back to have the implants replaced. And then 9 months after, they had a recall on it. So I went back to have it surgically removed and a new one put in.
Wow.
And then a year and a half after, I had a rupture, so I had to go back.
So it means it doesn't just leave you.
Yeah, absolutely. It does not just leave you. So the goal is to be able to stay healthy, to build a strong immune, Because again, if anything happens to you, you have a stronger immune to fight. And also to just be a proactive person, eat healthy, exercise, have a balanced life, and make sure that you put into your body what is nutritionally beneficial to build that immune.
And you should be mentally sound too, right?
Listen, mentally is one of the biggest parts.
Right.
You know, before we started the recording, we were talking about, you know, the psyche of oncology, not only for the patients, but also for the nurses.
Okay.
And how important it is for psychological support to
Right.
also come in and support the entire team, not just the patient. So there are so many dynamics to the family that supports the patient and all of that.
Listen, what are the risk factors or the causes? You know,
Okay.
cancers do not have direct causes, but what are the risk factors?
Yes, so like you rightly said, cancers do not have causes, like direct causes.
Right.
Just for a few cancers, maybe cervical cancer that we can say HPV, but for breast cancer, the actual cause is unknown.
Right.
However, there are risk factors. Some risk factors are modifiable, just to say you can do something about it, and some are non-modifiable. Okay, you cannot do anything about it. One is the fact that you are growing. Of course, you can't stop aging.
You can't do football age and all those things with age.
However hard you try, you
Right.
cannot stop aging. Okay, and so that is one of the risk factors.
Okay.
And another one is the fact that you are a woman.
Okay.
You are female.
You are born female. You
Female.
can't do anything
You
about it.
cannot do anything
Right.
about it. The other thing is to inherit a defective gene from your parents, like you say BRCA1, BRCA2. These are genes that are known to increase the risk of developing breast cancer. Okay, if you have all of these, you have inherited that from, or you come from a family that has breast cancer, you can't do anything about it. If you had a choice, you would change families, but here is the case, you cannot do anything about it. However, there are some risk factors known that you can do something about. One, sedentary lifestyle.
Okay.
You sit in the office all day working, no exercises. Yes, so it's important to do something about exercise. We are encouraged to exercise 2 to 3 times in a week. Okay, and it's also important that your diet. Obesity is a known factor that increases your risk of getting breast cancer.
Okay.
And so you are encouraged that you eat healthy, reduce your weight, exercise as well. Okay. The other modifiable risk factors is smoking. These days, the young people are smoking all sorts of things. Shisha, cigarettes, tobacco, all sorts of
The
things.
females too?
Females too, yes, are culprits of smoking. And so we discourage that. We also discourage the intake of alcohol.
Excessive or at all?
Well, the books say 1 glass, but you and I know that my glass and your glass
different from your
is
glass.
different. And so, of course, we kind of discourage the intake of alcohol. Well,
Actually, new studies have shown that even the little bit of alcohol recently,
you see,
that it's not good at all.
So,
That there's no beneficial at all.
so we should quit.
quit.
I think that, you know, if you can, I think it's good to, or make it very occasional.
But were you taking alcohol before?
I was an occasional drinker. I was not,
Okay.
you
A
know.
fun.
I think that for me, my test came up environmental. So
Okay.
what's environmental? Environmental is everything, right? So it could be your lifestyle, like,
yeah, sure.
you know.
As she said.
Yes, like she mentioned, your lifestyle in terms of I was working, I was
Always
busy,
sitting.
I was not eating well, I was not exercising.
Okay.
All of that became contributing. For me, my family, it was not genetics.
Okay.
I was the first person to get it. So all of that plays a role. I think, again, being a woman, like Doc said, you can't help
can't,
that.
yes.
So you have to build a strong immune.
Right.
And the exercise and the food is a big part of our structure of that.
Right. So the types, I would like you to explain the types of breast cancers, the stages and all that.
Okay.
And so viewers, some of the pictures that will be shown on the screen may contain some graphics, so your discretion is advised. So if you can explain some of them using your
signs and symptoms.
Yes, the signs and the symptoms. So on the screen we can see some pictures showing. So this particular breast has a cut. What does it mean?
Yes, so this particular breast you see on your screen now is one of the signs of breast cancer.
So this one looks more like the orange lemon. Yeah, can we show that? Yeah.
The orange peel, how the orange peel looks like. It's called peau d'orange.
Okay.
Okay, so if you see this peau d'orange image, this particular image,
okay.
If you see something like this on your breast, we encourage you to report. You can see this breast also.
Yeah.
So you can see, yes, it's moving very fast.
Very fast. Yeah.
So for some of the breast cancer, it starts as a lump in the armpits. If you saw a picture that just went away, you could see the axilla, the armpits, where the cancer has started.
It started from the armpit?
From the armpit.
Okay.
From the armpit, and you could see this.
Yeah. So.
Yes, and so, and this breast too looks a whole lump. You can see the lump engulfing the whole breast. It's
so this is at what stage?
So this likely is a locally advanced breast cancer.
Okay.
So you cannot, by seeing it just like this, make a diagnosis.
Okay.
You may have to do an imaging. The imaging will tell you whether the cancer has spread from its area of origin. Okay, so it started from the breast, but it may have spread to the lungs, it may have spread to the abdomen, to other structures of the breast. So it's important that...
this one, the nipple is not even visible.
Yes. So some of the sign of breast cancer is a nipple retraction. Yes, you would see that the nipple, you already have a pointed nipple like this dummy, and suddenly you realize that the nipple is going in, it's retracted fully. It's also a sign of breast cancer. Also, for some people, they have sores all over, some rashes all over the breasts, okay? And that's what you see right now is somebody whose cancer started at the armpits. These are real pictures from the ward.
From the ward?
Yes, it started at the armpits. And you can see there's changes in the skin at the nipple areola.
The areola, yeah.
You can't even find the nipple any longer. Okay, so this is a big lump. This is the lump engulfing the whole breast.
So do people survive these kind of pictures?
Yes, so...
like the one with the lump, did the person survive it?
Yes, so for this person, when it came in at this stage, luckily there were no advances to other parts of the body. So it's still in the breast. The disease is still in the breast. And so it was managed locally. Yes.
So usually when the disease extends to other parts, that's when it's difficult to manage.
To treat, yes. So there are three goals of cancer treatment. One is you want to cure, for curative or palliative purposes. So, or you just want to conserve the treatment. So you either want to cure it. So if it comes in very early, stage 1, stage 2, where the lump is so small, you can quickly go and do surgery, remove the lump, and then manage it. Those stages, they are curable if everything works together. I mean, you don't have other comorbid already features. I mean, those ones you can work on to cure. But if it is advanced, where we find most of our Ghanaian women reporting very late stages is advanced, well, I mean,
you can't.
We do
but
not
she
want
was talking
to go
about
for cure.
reconstruction. So when do we do that?
Yes. So this is a reconstruction that was done for someone who reported very early. So we took off the lump, and then the breast was reconstructed beautifully.
Okay. Yeah.
Beautifully. You know, women, one of the fears why people don't come for treatment is because they are afraid they will lose their breast. But there is hope. If you come in early, this beautiful thing can be done for you.
So
the
this
breast,
one, is it silicone that has been put in, or what has made it?
yes, so
nice?
this is silicone.
Okay.
It's in the silicone. It feels just like the breast. For some people, they'll tattoo a nipple around it. And so if she exposes her body, you will see that as looking just like the other one.
Normal breast.
Yes.
So have people reconstructed both breasts? Are there instances where both breasts are reconstructed?
It can be done if you request for that. Some people would say, well, I even want you to take away the breast that is not diseased.
So that
So they
I will not have
any
any
breast at all. That's done outside the country. Most people who opt for these do it outside the country. But it can be done if you request for that.
So, Ms. Lutrot, you were talking about reconstruction. What was it, because the thing had spread all over the breast? That's why you went in for it, or there were other options?
No, my second opinion doctor advised that I do a mastectomy only because the type of tumors I had, the nature of it, that it always comes back. And because I was so young and my hormones, your hormones are part of what feeds into your tumors to make it grow. She didn't want me to have the issue of it coming back, of it reoccurring, and then I didn't catch it early. So she advised that I remove the breast completely. And because I was 40, she felt it was absolutely necessary that I get reconstruction done. As far as I'm concerned, honestly, I wish I had done both in hindsight.
Okay.
Because I ended up being cut on the side that didn't have tumors to even me up. And the scarring is equally as bad as the other side.
Yeah.
So I might as well had taken both of them off.
Okay.
But one of the things that most of Africa we struggle with is that the cost factor. So majority of women cannot afford to go through the reconstructive stage.
Where do you get your funding?
So majority of our funding comes from donors who pour into us. We do events in the US and raise money.
Okay.
And then when we come to Ghana, we put our Momo out and get everybody. My goal this year is to get everybody to donate 1 cedi.
Only 1 cedi.
You can do more, but if we get 1 million
So 1
people,
cedi or more.
if we get 1 million people to donate 1 cedi,
We get 1 million cedis. That's true. So
and that
little
can help
drops
us
of
a long
water
way.
makes a mighty ocean. So if you contribute 1 cedi or more to the Momo number that was on the screen, or that's on the screen now, you'll be able to save a life. Though it's small, but it will make a mighty ocean. For Pink for Africa, they are doing very well. They've gone to all the teaching hospitals, and they are now adding about 3 more hospitals, district hospitals, to
Our monthly donations.
the monthly donations.
And we also donate prosthesis. So we give, depending on your size, some of our women are very big.
Yeah.
Some of them are very small.
Okay.
So all of the sizes, we come out and we donate for free to all the women to just say, we see you and we want you to feel good.
Okay, thank you. So, Ms. Enam, the treatment of breast cancer, how is it like at the public sector?
Okay, so the main goal of treatment is surgery.
Okay.
So first, surgery is done, and then
Is it under the NHIS?
yes, I'm not sure if it is fully covered.
Okay.
Yes, so some part of it is covered under NHIS. However, some part of the treatment is chemotherapy. Chemotherapy, some of the drugs are on insurance. Yes, we must say thank you to the NHIA for supporting our cancer patients. So it's on insurance. What happens is if the tumor is big, then you can have chemotherapy prior to surgery. You can have chemotherapy, then after that surgery is done, and then you continue with the chemotherapy. Chemotherapy is not the only treatment for cancer. Hormonal therapy is there, and now even targeted therapy is there for cancer treatment. And then radiotherapy is also done as form of a treatment for cancer.
What do you say about support system for people who have cancer?
Yes, so people who have cancer need a lot of support.
Okay.
In terms of finances, in terms of social support, network support is so important. When the cost of treatment is expensive, okay, for the drugs that are covered on insurance, fine. There are other drugs that are not on insurance. And
I think
people
majority
have
of
to
them are
pay
not, yeah?
out of their pockets. Aside that, you need to do blood works, scans, all of that are not covered on health insurance. And that's a lot. Each cycle of chemotherapy, you would require to come in with fresh labs, you're required to come in with scans where it is important or it's required. Okay, so they need support. Treatment, especially when it's a chemotherapy phase, is a bit harsh. So treatment is harsh on the patient. We encourage the family members, you help them, you support them.
Financially, emotionally.
All of that
everything.
support is required.
It's required. So, Ms. Juliet, you said you had good family support. And how about the finances? How are you able to?
Well, you know, like I said, I come from a country with a similar insurance.
Yeah.
I had private insurance.
Yeah.
So my insurance was not an issue at all because I had a good insurance.
Okay.
I was taking care of.
So your insurance, okay.
Yes,
so it means we are in Ghana. So with Pink for Africa supporting people who have had breast cancer, the Momo number is there. Kindly donate into it so that the people, as they go through those harsh treatments, it will not be too harsh also in their pockets. Pink for Africa can support people living with breast cancer. Your final words?
I just want to share that we should take better care of ourselves and try to remove some of the stigmas that cripple us, because it does not help. It makes the doctors work very hard. And our pastors, we need our doctors to do the job. Pray to back us up, but don't talk us out of going to the doctors, please.
Okay, so just talk a little, since you have been there before, what do you tell those who are also battling with breast cancer at the moment?
Well, one of the things I share with any patient I run into is to hang in tough. Stand on your faith and know that God is going to get you through it. Pray for the right doctors, the right nurses to come your way, and stay diligent with what the doctors are advising. You know, jumping on these herbal journeys is not for cancer. The herbal stuff may fix other things. Like, you know, we've heard our women are showing up late, and it's because we go and we play. By the time we come back, we don't give the doctors a chance. So please, eat well, take good care of yourself through your journey, and trust the process. The doctors are here to really do a good job, so give them a chance to do it.
Ms. Enam, Chairman for Breast Screening Outreach.
Yes, and so like I always preach, it's so important to detect it early. Get the right treatment, and then you will survive it.
Oh, so short. Get the right treatment and you survive it. And early treatment or early detection.
Early detection. So yes, to come back to it, you can detect breast cancer early, even in your house.
Okay.
And that lump that you may have felt may be a sign of breast cancer. Like I said earlier, not all lumps are cancerous.
Yeah.
But maybe what you felt in the house may be a sign of breast cancer. And you sit at home and do nothing about it. And you wait, you forget about it and not do anything about it, and wait till it develops and becomes full-blown cancer, very big, engulfing you have not done anything good to yourself. So detect it early, let's treat it right for you, and then hopefully you will survive it.
In 1 minute, how would a man see that he has breast cancer?
So the signs are same.
Oh, same signs.
They are not different from the men. It's only that men have flat chests. So they could also have starting it as a rash, as a discharge from the nipple, as a bump or a small lump in there. Okay, so the signs are just the same. Or probably the nipple indrawing, okay, in inverted nipples. So for men, it's the same signs that we preach, the same signs you can see.
Early detection saves lives, as they have both shared their experience. Ms. Enam, who is an oncology nurse specialist, and Ms. Juliet Mills Lutrot, who is the CEO for Pink for Africa Breast Cancer Awareness or Advocate. She's also an entrepreneur, she's a mother, and she's everything. On the screen, we have the Momo numbers. Kindly donate for or to Pink for Africa, the merchant ID and everything for your support. When you support with 1 cedi, it can do a lot of good. So thank you, beautiful ladies. I'm reminding all of us that this show is brought to you by Unicom Chemist. Unicom Chemist is your #1 pharmacy. It's all over Accra here and some parts of the country. If you are buying anything in wholesale, remember to go to Unicom Chemist. And if you are doing a retail, go to Unicom Chemist for trusted and quality drugs and medicine. Thank you all for watching Consulting Room 5. We are in October. That's why we are all in beautiful pink. We have Miss Enam gave me this to continue with the campaign. If you have it, wear it throughout the month of October to also create awareness. If you have or you are battling with breast cancer, there is hope, and always be positive. Keep it in mind that there is hope for you and everything will be fine. Thank you, ladies, and thank you all for having me. Bye.